things on therapies and things we can do. Well, first and foremost, as you know, as I mentioned earlier on the right hand, this is sort of what happens with airborne transmission of respiratory particles. When we talk, we spew countless number of different respiratory particles of various sizes, some of them smaller, some of them larger. And if you don't have a mask, everything just comes out. And so some of these larger particles will fall by gravity to the ground. And that's one of the reasons why humidity is actually helpful in minimizing transmission, because with the humidity in the air and the moisture in the air, once these particles come out of your mouth, they collect the moisture that's around them and get heavier. And as they get heavier, they fall to the ground and hopefully minimize the distance in which they can travel. But then if you wear a mask, you're not completely getting rid of all of the things that can be transmitted from your mouth, but you're getting rid of most of it. And so you still need to sort of distance yourself from individuals, even if you're wearing masks. But the masks significantly improve the transmission. Why are the masks important? Well, there's three main reasons. One of them is that there are folks who have COVID that, you may have seen this in the news, that are asymptomatic. In fact, upwards of 40 to 60% of people are believed to be asymptomatic, depending on the cohort that you look at. This is unlike other sort of viral infections like the flu, or you may have heard of the SARS about 15, 20 years ago, or even the MERS virus, where many of the respiratory viruses that we've seen in the past, people aren't infectious until they develop symptoms or several days after they develop symptoms. COVID is very different. You can actually be infectious 1 to 3 days before you actually start developing symptoms. And so you don't know that you're infected until after you've interacted with a number of folks and potentially have transmitted the virus in your nose or in your mouth or in your lungs. The second, and so the last one is that when you wear a mask, you potentially minimize the possibility of what we describe as self-inoculation or infecting yourself. As you know, if the COVID is sort of on surfaces or on objects, and you touch it and you get it on your hands, the way you get infected is not that the virus now sort of dissolves into your hands and through your skin. It's often is that we put our hands to our mouth and our nose and we scratch them, and we do it countless times unbeknownst to ourselves. And hopefully by having a mask, if you're sort of in the habit of reaching out and scratching your nose or scratching your mouth, you have at least a barrier to prevent that. The second issue is social distancing, keeping at least 1 meter, if not more, apart from each other. In the United States, we say 6 feet, which is about 1.8 meters. So the further you are, the better. But at a minimum, you need to be at least 3.2, 3.3 feet to stave off the likelihood of getting these larger respiratory particles, which is with the majority of the way the virus transmits. And the last thing is to minimize what people describe as the 3 C's, not in terms of sort of diamonds, but sort of in terms of infection. And this 3 C's are avoiding trying to be in closed environments, being in very crowded environments, and when you're having conversation, being close to individuals to have that conversation, just like that picture on the right describes. Try to do things outside if possible. As I mentioned earlier, UV, heat, humidity, all sort of help reduce the half-life of these viruses. And to also minimize your exposure by planning sort of your trips out of the house and lumping things together. Going to Costco to get a watermelon and then going back the next day to get paper towels may not be the best sort of best strategy with regard to minimizing exposure. Lumping sort of these trips out so you minimize the amount of time you're really exposed to folks who might be asymptomatic.